Hello, my name is Brittany Kabinski and I just want to welcome everyone. It is now 1 p.m. so we will begin our presentation shortly. Today on Friday, March 2nd, we will have our presentation on community development in a global context, gender-aware planning in African cities, given by Charisma Acey. For help during today's webcast, please feel free to type your questions in the chat box found in the webinar toolbar to the right of your screen or call 1-800-263-6317. For content questions, please feel free to type those in the questions box and we will be able to answer those at the end of the presentation during the question and answer session. Here's a list of the sponsoring chapters, divisions, and universities. I would like to thank all of the participating chapters, divisions, and universities for making these webcasts possible. This is a list of the upcoming webcasts we have scheduled for the next few months. To register for these upcoming webcasts, please visit www.utah-apa.org/webcasts and register for your webcast of choice. We are also offering distance education webcasts to help you get your ethics or law credits before the end of the year. These webcasts are available to view at www.utah-apa.org/webcast-archive. You can now follow us on Twitter @PlanningWebcast or like us on Facebook, Planning Webcast Series, to receive up-to-date information on the Planning Webcast Series sponsored by chapters, divisions, and universities. To log your CM credits for attending today's webcast, please go to www.planning.org/CM, select today's date, which is Friday, March 2nd, and then select today's webcast, Community Development in a Global Context, Gender-Aware Planning in African Cities. This webcast is available for 1.5 CM credits. We are also recording today's webcast, and it will be available along with a PDF of the presentation at www.utah-apa.org/webcast-archive. At this time, I would like to introduce our speaker for today, Charisma Acey. Charisma Acey is an assistant professor at Ohio State University's Austin E. Nolan School of Architecture. Dr. Acey's background includes extensive work, research, and travel to countries in Africa and Central America. Her research focuses on international community development, poverty alleviation, and human-environment interactions at multiple scales in urban areas of developing countries. Most recently, she spent time in Uganda and Nigeria looking at issues of gender empowerment at the community level and introducing sustainable household-scale alternative energy solutions. She recently had an article published in Gender and Development, Gender and Community Mobilization for Urban Water Infrastructure Investment in Southern Nigeria. She has earned both a master's degree in public policy and a PhD in urban planning from the School of Public Affairs at the University of California, Los Angeles. Let's welcome Charisma Acey.
Thank you very much, Brittany. It's my pleasure to be here to be part of the APA webcast series today, and I'm excited to share with all of you a topic that's close to my heart, which is all about community development in African cities in particular. And one of the main findings that have come out of my work on helping to improve household access to water, sanitation, energy, and other basic services is the critical role of women in the household and women participating in governance and being at the center of or needing to be at the center of our policies and planning to improve access for people. So the title of my talk today is Gender-Aware Planning in African Cities. Community development in a global context. And I think I've hit my first snafu as my slides do not seem to be advancing. Hold on one second. Here we go. All right, so let's get to the next slide. So what is today's presentation about? Well, it's about two things. Looking at women, infrastructure, and services, both women's access to basic services and infrastructure, particularly networked infrastructure like roads and piped water, and sewerage, and service delivery, and then this idea of gender-aware planning. So what is gender-aware planning? Carol Roccotti, a scholar, first came up with this term in an article in 1991 called Cities and People Towards a Gender-Aware Urban Planning Process. It was published in the journal Public Administration and Development. And basically her argument was, despite the recognition that kind of a technical approach to planning, using a blueprint model and relying on experts, that we know that that's deficient, planning is still gender blind. And so that's despite, increasing community participation and engagement, particularly since in the shift to governance and particularly since the 70s, we're still gender blind. And so what she argues is that gender-aware urban planning would recognize women's economic and social roles in urban settings and the ways in which women become excluded from economic opportunities and decision-making. Now, my particular area of research is I look at basic services, but my dissertation work particularly focused on household access to water. And this issue of women's economic and social roles really come together around water, both because women are at the center in the household in all of the African cities I've visited in terms of their responsibility for making sure the household has water so it can function on a daily basis, but also the responsibility for acquiring that water. And so when the government is not able to provide basic services like water to the household, that puts an increased burden on women to make up for that for the deficiency, in public services. Okay, so this is an overview of the presentation. First, I'll be looking at the relationship between women and infrastructure. We'll look at some data around women's access to basic services like water. Then we'll move on to looking more closely at the data from my field work last year and in 2010 in Nigeria and Uganda, talking to women about their access to infrastructure, their satisfaction with basic services, and their sense of community, how their struggles with accessing basic services affects their quality of life and their ability to collaborate with their neighbors to improve their access. Thirdly, we'll talk about some frameworks for thinking about how would we achieve gender-aware planning, and how would that improve life on the ground, not only for women in their roles in their responsibilities for securing basic services for the household, but for the entire community. And so what are the appropriate frameworks that exist for fostering gender-sensitive planning? And then lastly, just kind of to sum up, looking at the data from the literature, what we'll talk about today, what are the implications or possible results of using such frameworks. Before I begin, I wanted to include a quote from Dr. Wangari Maathai, the late Dr. Maathai. She was the first African woman to win a Nobel Peace Prize and the first environmentalist to win a Nobel Peace Prize. And her work, her environmental work went hand in hand with women's empowerment. She was doing work in Kenya around tree planting and preventing deforestation. And it was all about educating and empowering women that had a huge environmental impact as a result. And just a reminder that even, and I always have to remind myself this, even as, we look at some of the statistics, which are quite daunting and challenging when we look at, we'll see some slides shortly about the lack of access to water and sanitation, and some of it can be grim, but there are people every day in the field working diligently, tirelessly to improve life on the ground in the communities. This work goes on every day. And so she says countless across the globe work quietly and often without recognition to protect the environment, promote democracy, defend human rights, and ensure equality between women and men. By so doing, they plant seeds of peace. So let's talk about women, services, and infrastructure. I think putting pictures to words before we look at data is useful to kind of think about. I don't know how many of you have worked in developing countries or have worked in African cities. It's a question we'll ask on the survey at the end of today's presentation. But I often, talk to students who've never been out of the country or who have never been in a developing country setting, and it's quite different. We take a lot of our access to things like water, being able to turn on the tap or flush a toilet, for example, for granted, or turn on a stove, all of those things. So some of the challenges, as I said, women are at the center of the household in terms of their responsibility for securing basic services, for educating their children, for providing health care for their families. So these are pictures from my field work in both, some of the pictures are from Nigeria and Uganda. In terms of water, there are a number of challenges revolving around not just the quality of water, but actually physically being in reach of a piped network. And so we tend to think about rural areas tend to come to mind when we think about the lack of access to water, but the reality is in most African cities there are huge numbers of people who have to search or fetch water every day in the cities, and sometimes it's done from unclean, open sources such as streams or open wells, where they have to buy water. And the UN World Health Organization UNICEF Joint Monitoring Program says that people who have to buy water to get clean water do not have access to improved sources of water. So when you include people who have to buy water, as well as people who fetch water from unclean sources, we get up to nearly 1 billion people worldwide, and a majority of people living in African cities are in that dilemma. Sewage and sanitation. Sewage, if we think about water-based sewage, where does the water flow when it runs down the sink or into the streets? Where does it go? So being able to channel wastewater out of the city, is a huge impact on public health as well as waste management. And many of those kind of basic services are lacking on the ground. Housing. I have a picture here in the top right of your screen. This is the community of Mokoko in Lagos, Nigeria. It's a community actually built on top of water. How land is so scarce and is at such a premium in Lagos that people have had to extend the land, so to speak, into the water, into the Lagos Lagoon, and build houses on top of water. And of course, there's no running water, there's no sewage. They boat to get back and forth, and so you can imagine some of the challenges there. Energy is another critical issue, and one of the interesting things I found in the field is how some of these services are linked together. So, for example, in Nigeria, the lack of constant energy supply impacts water. So if you're in the city, you're in the city and the electricity goes out, well, it also impacts the pumps that push water to those households that do have access to the piped water network. So when the power goes out, water also goes out. So that means people are forced to buy water from other households that have stored water or who have generators and are able to operate their water pumps. It also means water becomes much more expensive at times when energy is out. So that's just an illustration of how these issues can be interrelated. And so you can't just look at one of these services in isolation. You have to look at how they interact with each other. The quality of roads is another huge infrastructure challenge in many cities. This is an image from Ifako Ijaye local government in Lagos. The image above the caption for roads. I don't know if you can appreciate how eroded the road is, but it's quite bumpy, full of rocks, full of debris. It's eroded to the point where you can see a defunct water pipe flowing to the right of the screen. Well, and that ties into the next slide with health. People have accidents. Young people, particularly old people, elderly, walking through communities, have accidents all the time, break arms, break hands, break legs because of the lack of quality roads. And combining that with the lack of adequate health care, that's another way that infrastructure impacts families. And then on the last slide, I have an image of a community classroom. This is education under health, above health and education. This is a nonprofit that I work with in Uganda called the Amagezi Gemanyi Youth Association. And the nonprofit is focused on youth, but they recognize the fact that the women, the mothers of the youth, had a huge need both to earn income. Most of the families in the slums that this nonprofit serves are single women-headed households. Most of the women of the children who come to the survey, and I found this to be true when I did my surveys, don't have much beyond an elementary school education. And so they have limited opportunities to earn income for their families, and most of the women's biggest concerns was not the infrastructure, despite how challenging it is, it's their desire to send their children to school. And so this organization started community literacy classes for the women and other income generating opportunities. But just to talk about what are some of these interrelated challenges. So if energy supply cuts out, that affects the price of water. You need money to buy water from people who do have water, but if your livelihood choices are limited by your education and so forth. So you see how these issues are all interrelated. Now, as I said, my research so far is really focused on access to water, so I wanted to go into a little more detail around water supply and some of the challenges when it comes to access to water. This is from a UN Habitat 2001 report, one of the State of the World Cities reports, that looks at comparing the average daily time spent and distance traveled per household by their primary water source. And it compares the distance and time in 1967 to 1997. So the question is, have things gotten better? So all of the places where you see the white bar, that's 1997. Where the white bar is longer than the blue bar, that means the total distance to water has increased, or the total time to fetch water has increased. And you see that that's true for most of the sources of water, whether it's a kiosk where you buy water, buying water from a neighbor, getting water from a well. Part of that is population increase, more competition for scarce resources, and then also as people migrate to cities, it's the inadequate pace at which infrastructure has kept up with urbanization in many African cities. Another dimension of water access in cities has to do with how often does it run per day. So just because you have a pipe in your house or a pipe stand that serves many households in your community, it doesn't mean that water is flowing through that pipe or flowing fast through that pipe. And so these are some statistics from cities around the world showing how many hours a day piped water runs. So you see in Mombasa, Kenya, you have an average of 2.9 hours per day. So that means out of a 24-hour period, there's only going to be water flowing through the pipe for at most up to 3 hours. Places in India, Chennai, Hyderabad, 1 hour a day. Madras, water only runs every third day, and so forth. So that's another dimension of access to water. So it's about the availability of water in terms of its pipe stand, in terms of your proximity to a source of water, but it's also about how adequate is that water and how reliable is it. Now, one thing I will point out that's another dimension of the access picture that came out really strongly in my field work is reliability. So one difference, talking to my colleagues who work in India, is that even though the water only flows several hours per day, they publish schedules in the paper informing residents when the water will run. So people can build in some kind of regularity in their household schedule around collecting water because they know when the water will come. In the cities that I've been to in Nigeria and then more recently Uganda, where water is inadequate, there is no published schedule, and so you don't know when water is going to run or not. And so that's a huge burden, thinking of women who have to, get their children to and from school, who have to cook for the household, who are responsible for water. Not knowing when water is going to run is another very specific and very daunting challenge. I'm sorry, this is a repeat slide. Okay, the next slide. So this is a slide from the UN World Health Organization Joint Monitoring Program around improved and unimproved sources of water. I put this here so that you understand the statistics, and I'm going to talk around access to water globally. I'm going to talk about the UN Millennium Development Goals shortly. But when you hear the statistics, nearly 1 billion people lack access to improved sources of drinking water. The actual situation is worse than the statistics kind of indicate. So 1 billion lack access to improved sources of drinking water, but improved source of drinking water doesn't mean a tap of treated water coming into your household. Improved sources of drinking water includes all of these things in the top blue box. So piped water coming into your house or maybe your yard if you share dwelling with a number of residents. Think about an apartment community with multiple residences, or your house plot, but it may not come into your house. Improved water may also be a public tap or a standpipe. We were in communities where doing our surveys where one pipe stand serves hundreds of people. Might serve 50 households, which is hundreds of people around a public pipe stand. So even, again, that goes back to the other dimension of access. Even though you may be in proximity of a source of water, it doesn't mean that it's adequate. And that's another particular challenge when it comes to sanitation, particularly for women. Again, if you're not near a place to use the bathroom. Public latrine is not necessarily access to sanitation for anyone, but there are specific challenges for women around public latrines. So public taps or standpipes are included in improved sources of drinking water. Boreholes, so those are deep wells that go hundreds of feet into the ground that tap into groundwater sources, protected wells, protected springs, and rainwater. So people that lack, when you hear the statistics about 1 billion lacking access to water, those are people that don't have access to any of these improved sources of water. And below you see the unimproved sources of drinking water. So what are the relationship between water and health? So we just talked about how some of the services or the lack of services impact each other. Now looking at water, how does that impact health? So these are some statistics from Ghana, comparing Ghana, Indonesia, and Brazil, cities, Accra, Jakarta, and Sao Paulo. You see Accra in Ghana, in West Africa, more households. This is from a studies done in between 1994 and 1999, published in the 2001 State of the World Cities Report. So you see in Accra, 46% of households had no water source at their residence. So that means they're using some kind of community or shared water source. 13% in Jakarta and 5% in Sao Paulo at the time of the study. Sanitation, the percentage that share toilets with more than 10 households. Again, in Accra, you see 48%. And so forth. So you can see some of the statistics there around water, waste, indoor air pollution. So that's the energy challenge. Having to use fuel wood or charcoal is tied to acute respiratory infection, other health problems. Also, the lack of sanitation attracts pests, supplies, disease vectors, and so forth, and overcrowding with the number of households. And then the table on the bottom looks at the same statistics but divides it by income class. And we see here the burden on the poor is the greatest. While everybody is impacted by these statistics, including the affluent in terms of some not having access to water or sanitation, it disproportionately impacts poor households. And so one of the consequences of having to fetch water and store water in open places is acquiring diarrhea. And so this table just shows the odds ratio of the risk ratio of becoming sick with diarrhea linked to some of these factors around not having adequate water, clean sources of water, and sanitation. So when you have to use a pot for storing water, which is quite common, you're 4 times as likely to have diarrhea and so forth. So these are extra burdens on poor households, on women-led households, and so forth. So talking about deprivations, the lack of infrastructure. This all centers around housing, and there's a great book that I like to refer to by Sandy Sarencross called "The Poor Die Young: Housing and Health in Third World Cities," and the book really makes the connection between public health and housing. Looking at housing as not just the structure, but as a bundle of services that includes infrastructure and basic services delivery that are critical to public health. And the book makes the argument through case studies that we can't look at public health in isolation or look at it as primarily about medicines and treating illness. But we have to look at things like planning and governance and infrastructure. If we can improve people's housing, we can improve public health. So the link to some of the gender challenges here. You'll see in some countries a higher percentage of women-headed households have 3 or more shelter deprivations. So what are shelter deprivations? These are how the UN classifies what is a slum. You may have heard the word, if you read development literature, you may have heard the word slum. And what exactly does that mean? Well, the UN classifies it as an area with 1 or more shelter deprivations. Shelter deprivations include quality house or the lack of quality housing, overcrowding, the lack of improved water source, the lack of improved sanitation, and insecure land tenure. So an area where the majority of people lack one of those things is considered a slum. And we see that in some countries, women-led households, more of them live in households that lack 3 shelter deprivations over 1 shelter deprivation. So that means living in slums. Other challenges around women-led households. Land tenure is tied up in gender and often is not extended to women. You still have dual systems of property rights in countries where there's a traditional system of property rights operating alongside a more civil property rights, and women may not have access to land, even in cities. You also find women having to migrate to cities in order to earn a livelihood to support their families. And women, and even back in the rural areas, as men leave for cities, it creates further hardships for women. So there's all kinds of ways that urbanization and the impact of inadequate infrastructure services impacts women, how they're related directly on women and indirectly through what ends up happening to the family. So what has been done so far to address this? The UN Millennium Development Goals, I know most of you probably heard of these. In September 2000, the world came together and agreed for the first time on a common set of targets to reduce extreme poverty by 2015, and those have come to be known as the Millennium Development Goals. And there are 8 of them, but there's a whole host of targets and indicators underneath that countries are supposed to meet, and these Millennium Development Goals have been tied to receiving aid and debt relief and so forth to kind of push countries to move towards achieving these Millennium Development Goals. And it's interesting, if you go into communities, I find that most people are aware, even though the UN MDGs are a high level kind of thing, you know, the level of national governments coming together around these goals, it's penetrated down to the ground, and people know about the Millennium Development Goals and know that their governments are supposed to be doing something to help them achieve these. They may not know the details of it, but they do know about the MDGs. What I'll say here just about them is that, in terms of Africa, is that while all of the whole world has made progress towards eradicating extreme poverty, if you look at the MDG website, there's been huge progress made towards the percentage of people, reducing the percentage of people living on less than $1.25 a day. Of course, there's a lot of criticism around poverty line statistics, so we may have reduced the number that live on less than $1.25 a day, but if you make $1.50 a day, are you much better off than someone that makes $1.25? Is a fair question. But you know, using that measure, and that's what the MDGs are all about, kind of giving us benchmarks and something to work towards, to achieve, that we can all see and agree that progress has been made. There has been progress made on that. And around the world, most regions have made progress towards all of the Millennium Development Goals. Unfortunately, among African countries as a region, they're behind on meeting most of the MDGs. And I just want to circle here, you know, where does water and sanitation fit, or housing fit? It falls under Goal 7, ensuring environmental sustainability. You see one of the key targets here is reduce by half the proportion of people without sustainable access to safe drinking water, as well as achieve significant improvement in lives of at least 100 million slum dwellers. So at the very highest levels, there's agreement around what we need to achieve. But in terms of, you know, access to water, these are really these are local government challenges, and increasingly, as governments have decentralized and kind of put the responsibility, or burden, I should say, on local governments to meet the needs of the people, oftentimes without funding that mandate, this is really a local challenge. It's a planning challenge. It's a governance challenge. So you have the high-level MDGs, but the issue is what's going on the ground. This is just the last MDG here on this slide, develop a global partnership for development. So that has to deal with aid, and the flow of aid to countries is part of the Millennium Development Goals. So now I want to talk a little bit more specifically about Uganda and Nigeria, and what I found there, and how that relates to what kind of the overview of these challenges around networked infrastructure that we just talked about. Now, Nigeria is located in West Africa, and Uganda is in East Africa. And I just circled the capital cities there. Lagos on the left is circled. It's right on the Atlantic Ocean coast. And Kampala is adjacent to Lake Victoria in East Africa. So the first thing that both case studies will highlight is the gender gap in service provision. So this is an interesting picture here. This picture is from Lagos. You see a woman with a bucket of water. She's just filled it from these large water tanks here. The man in the picture owns those water tanks. It's a community that is in the city, but is miles and miles away from the piped water mains. And so the man himself, we interviewed him, he used his own money, his own capital, to buy pipes and pay someone to tap into the water mains and lay miles of pipe from the water mains and bring it to this community. And then he sells the water to the community. Now he is providing a service, and he is improving access to water you know, in this community. What's hidden, and what I'm getting at in the talk today is the gender issue, which came up over and over again. Hidden in this is that women are responsible for collecting water. So the fact that the state is not providing water to this community, a woman who is often not in the business of providing water must, enter these gendered relationships to secure water from men who sell water in the community, and they have to get money from their husbands, or they have to find ways to earn money on their own, separate. I found that a lot in Nigeria, where women were given had the responsibility to come up with the money for school fees and money for water on their own. And so that's why you see a lot of women engaged in petty trade on the streets, things like that, earning enough money each day in order to buy either that day's or the next day's supply of water and food. Other issues that impact the gender gap around services provision, again, I'll mention again women-headed households. We saw that many women live in households with multiple shelter deprivations. The state of society, women's role in decision-making, their agency, their ability to make decisions, and that's going to come up later when we look at the survey data in terms of how to manage the affairs in their household, whether to have children, how they obtain money from their husbands, how they can spend the household budget. All of the women's role in household decision making is bound up in the gap. And this also affects the ability of poor households to reduce their own vulnerability. And this has an impact on livelihoods and empowerment. What is not as studied in the literature is the impact of inadequate infrastructure and services on women's ability to participate in governance. That is not well understood, or their ability to engage in livelihoods. I mentioned earlier about the randomness of water, when will it flow, and having that being a constraint on what you can do with your day. So the question is, how would a model of gender-aware urban planning, going back to Riccotti's definition, recognize women's economic and social roles in urban settings and the ways that they become excluded from decision-making and economic opportunity? So in order to get some information on this, I engaged in a mixed methods research study. We did household surveys, ethnographic, meaning face-to-face in homes. We did semi-structured interviews as well and recorded them, and made observations at the neighborhood level in urban areas of Kampala and in Lagos and in Benin City, Nigeria. So there were 3 cities altogether where I did field work. The primary data consisted of 204 surveys, so 49 were gathered in Kampala and 155 between the 2 cities in Nigeria. We also recorded 8 semi-structured interviews. And then this was backed up by secondary data from the demographic and health surveys done in Nigeria and Uganda in 2008 and 2006, respectively. Demographic and health surveys is an organization funded by USAID and others that carries out regular surveillance around public health and demographics in more than 30 countries around the world. And if you Google Measure DHS, or if you just go to measuredhs.com, you have free access to these reports, to data. There's mapping tools available on the website, and researchers can also sign up and get access to the actual statistical data set so that you can run your own analysis. And I mention this because this is a great resource for people who are looking to learn more, to do more research on developing countries, because it can be quite difficult to find good data. Unlike here in the U.S., where we're kind of overloaded with data, and we have the census and it's free and available. Censuses are often not conducted regularly or not digitized. It can be really difficult to find good quality demographic data. So this is one source to use. So we collected primary data and used that secondary data. And in country, I worked with community partners on the ground. So I mentioned one nonprofit in Uganda, the Amagezi Gamanyi Youth Association, and Makerere University. I also talked to faculty there. And then in Nigeria, I worked with Omige and Associates, and I should have put the University of Lagos and the University of Benin, because every time I go to Nigeria, I work with the faculty and some students there as well. So the questionnaire, in order to get at how women feel about their access to basic services and infrastructure and how that impacts their quality of life and sense of community, we used a sense of community scale. It's a 15-item scale, and we'll see what the questions are in a couple of slides. The scale was designed in the U.S. to measure how new innovations in housing, like kind of smart growth housing and higher density housing in urban settings, impacts people's willingness to interact with each other. But when you look at the tool, it's the questions. I wanted to test whether these same questions could be used in other settings to gauge a sense of community. So part of this study was also exploratory to see how useful this instrument was. We asked about their status. In addition to the sense of community scale, we also asked the women surveyed about their satisfaction with neighborhood amenities and services like healthcare, education, roads, water, electricity, crime, food security. We asked open-ended questions about why did you move to this neighborhood, and then collected demographic questions, and with the intent later to do some analysis around those demographic questions. So this is the sense of community scale. This comes from Nasser and Julian, published in 1995, and they found that this scale was a robust way, because other psychological sense of community scales before then had hundreds of questions, yet they found, and they did testing, item testing, rating reliability measures and all of that, and found that you could get the same robust test of sense of community with just 15 questions, which has a huge impact on being able to, in terms of affordability of doing these kind of studies and replicating results. And so these are the questions, and you ask each individual to what extent do they strongly agree or strongly disagree with these statements, and they range from, do you feel that you're similar to most people that you live around, or can you find help if you need it, or how are the police, or are there friends in the neighborhood? If there are problems addressing the neighborhood, people would get together and solve it. That was when I was particularly interested in the African context, because I wanted to know to what extent did people feel like they could work with their neighbors to overcome challenges around basic services delivery. Now, there were some data collection challenges related to this survey in terms of getting a systematic sample, going back to the lack of easily available census tabulation areas, or a complete, like a phone book listing of all the households. Random selection is a huge challenge, so I relied on snowball sampling, where you talk to people and you ask them to refer you to 5 other people, and you ask each of those to refer you to other people. So we used snowball sampling. Administering the survey, so there are some language challenges involved, and so I worked with the organizations that I mentioned earlier in teams to do translation on the ground. Interviewer bias. This is always a challenge when you're administering surveys, and you have one intent as the researcher in terms of collecting data, but the person who's doing the actual interview may emphasize some questions or not, or be thinking about, if you're working with nonprofits, I've found they're looking at potential funding, and so I've had to talk to some of my counterparts, like, don't encourage them to answer the data, to give the worst possible answer, we just want their honest reaction. So those are some of the things that come up. Question comprehension, again, using an instrument that was designed in the U.S. context in another setting, So there were some challenges in terms of us needing to reword the question or think through what the question actually meant in the local context and adapting it. And then there's sensitivity, real sensitivity around collecting certain demographic information. People are not as used to giving up their income, what they do, what they spend their money on, all of those kind of things on a regular basis like we are here. Even if we don't like it, we're kind of used to being asked those questions. Very sensitive, and so can be difficult to collect those in the field. Excuse me. For this presentation today, I'm nearly out of time, and I'm not able to go into a lot of the graphs and details, but I just wanted to summarize a sense of what were the main findings that we got out of this study. And so these are the questions that in the end that we asked people about. This is how we adapted the sense of community scale with the questions that you see on this slide. And we found that there was most disagreement with questions 1, 6, and 8. So you are similar to most people who live in your neighborhood. People disagreed with that. They felt that they were not like the people who lived in their neighborhood. And we found that more so in the higher density areas or the more low income areas. We found more people saying that they were less similar to the people they lived with. 6, your friends in your neighborhood are part of your everyday activities. There was a lot of disagreement around that. People tended to keep to themselves. You have friends in your neighborhood on whom you can depend. Again, while for very superficial things people talk to each other, but when you say friends, which has a much deeper meaning, people disagreed with the idea that they actually have friends in the neighborhood that they could depend on. People were neutral on questions 4, 13, 14, and 15, so neither strongly agree nor strongly disagree. This one I just want to highlight, question 4, the police in your neighborhood are friendly. So this is another instance where we learned something about, how we might have to adapt the question or think about using it in other contexts. So people were not comfortable talking about the police or wanting to say whether the police are friendly or not, for fear of retaliation. There's not that good relationship with the police in the communities where we went, particularly the lower income communities, but even in the affluent communities we surveyed, people they would make faces indicating that they were not satisfied with policing services, but didn't really want to indicate strongly either way. There was most agreement with questions 2 and 5, so if you feel like talking, you can find someone in your neighborhood to talk to right away. Again, we found that more in the higher density settlements. That's just because people are always around. There's somebody around. So yeah, people say, yeah, there's always someone to talk to. 5, people in your neighborhood know they can get help from others if they are in trouble. So even though, so this is where you have to get into, how much correlation is there between these questions, because some of these questions kind of get at the same concepts in different ways. While on one hand, people would not say that they had friends on whom they could depend, they did say that they could get help from others if they were in trouble. 10 was the question that had the most strongest agreement. If someone does something good for your neighborhood, that makes you feel good. So there is some kind of attachment to where the women we talked to lived, in the sense that things that happen in the neighborhood, they feel like it also impacts them. Relatively few expressed strong agreement or disagreement, I should say, with any question, but among those who did, the highest number of strongly disagree responses came around how people care about their neighborhood, question 3, the police question, finding if you're upset, finding someone to talk to, having friends in the neighborhood, and having neighborhood leaders that you can trust. And that last one, number 14, was something of particular interest to me because of the importance of neighborhood leaders in terms of improving basic services in the community. In terms of asking people about their satisfaction, the women about their satisfaction with neighborhood amenities, there was most dissatisfaction around the state of roads and clean water. There was more expressed satisfaction with education, electricity, the level of crime, and food. What I will say about education and electricity, and this again gets into how we word the question. So we were intending to ask people about their satisfaction with public education, or the state provided electricity. But what people responded based on the fact that there's a lot of private schools, for example, around that educate children. And so they're satisfied with the private schools, but the private schools are quite expensive and they can't send their children there. They dislike the public schools or the government schools, but they're satisfied with private schools even if they can't send their children there. So some of those things that you don't know until you go to the field and actually talk, and that's where the interviews, the recorded interviews, actually help to elaborate and shed light on some of the data we collected through the surveys. So remember, we also asked the open-ended question about why the women we talked to moved to this neighborhood, again with the intention of later correlating satisfaction with the neighborhood or sense of community with reasons for moving to the neighborhood. So these are not in any order, but these are some of the things that women told us. So the location of the neighborhood, transportation was important. The fact that the neighborhood had water was important. That the house belonged to the family, so it was just a house handed down. Some people did mention that neighbors were an important part of why they moved to the neighborhood. And the other thing I should point out is how much infrastructure plays into a part of why people decide to move to where they live. So you can see electricity, sanitation, roads, water are some reasons that people chose their neighborhoods. The fact that it's peaceful or there's security, that was more of an issue in Nigeria, the security of a neighborhood. And then some women just said they had no choice in the matter. The decision was not in their hands. These are just some of the background demographics on who we talked to. So the number of children in the household on average was 4. This is across the whole study. Marital status, 42 women were single, 140 were married. That includes traditional marriages, so marriages where there may not be, it may not have been done in a court. It's not a civil marriage, but it's a traditional ceremony. 12 women were widowed and 9 had been divorced. In terms of housing tenure, the majority rented their housing, 111, 54 owned their housing, and 29 lived in some kind of familial relationship. And there were a mix of housing types, and this is one thing going forward I want to look at is how does the type of housing you live in, whether it's single family or multifamily or flats, apartments or rooms. These are one room living quarters, which are quite common, particularly in Lagos, where housing is at a premium and land is scarce. Whole families will live in one room or in 2 rooms, which they call room and parlor. So how do those kinds of housing configurations impact women and sense of community and their ability to secure basic services services for their families? So we're almost to the end. So I wanted to wrap up by talking about what are the frameworks out there to kind of bring this together. We know that the lack of infrastructure and basic services differentially impacts women or imposes a higher burden on women in these settings where they have the main responsibility for the household, but also face challenges in terms of their own roles within their families, within their households, and within their communities in terms of their agency and their ability to make decisions. So we know that differential impact exists. So what kind of frameworks out there exist to help us understand and incorporate into new kinds of planning, either advocacy planning or practical approaches to planning or interventions that can improve things. I'm going to go through these in a couple of slides, but we're going to talk about livelihoods, this notion of going beyond thinking about income earners to livelihoods. Most African cities are the majority of the economy is the informal economy, so it's not kind of regular salaried or hourly employment. And so it's the informal economy, and people do a whole variety of things, including barter and trading their time and all kinds of relationships in order to secure the basic services and that they need for the household. Gender-aware planning specifically, and the idea of women's empowerment, and then sense of community. What do these concepts, how can they help us move closer towards planning that is sensitive to these disparate impacts by gender? So the livelihoods framework, this is from a paper before the World Social Forum in 1995 by Chambers called Poverty and Livelihoods, Whose Reality Counts. And this is really the beginning of, the paper was a challenge to professionals in development to go beyond the statistics that are found in published places, which miss out on this informal economy and the reality of the poor. And so it looks at how people secure their livelihood, how they make a living. It has to do with their capabilities, which has to do with what Amartya Sen, the Nobel Prize winner, talked about, people's ability based on their human capital to exchange who they are and what they are for what they need. So their capabilities, what assets do they have, and these assets are either tangible, so claims, so again tying to women's access to land, and maybe the fact that maybe they don't get extended land tenure, and how that impacts their ability to secure quality housing and adequate infrastructure. And then tangible assets, how much are you able to store if you're on a day-to-day basis in terms of earning money through petty trading in order to earn a living. Then how much are you able to store to withstand a rainy day, so to speak. So this is a framework that could be a really useful one in terms of helping us think about a model of gender-aware planning. There's another framework that's tied to the livelihoods approach called the Asset Vulnerability Framework. This was published by Carol Moser in 1998, looking at how do we reduce urban poverty, new ways of thinking about it. And again, it's broadening our understanding to look at human capital, labor, housing and infrastructure, bringing all of these things under one umbrella, and looking at the capacity to respond to changes in the external environment. And what Carol Moser says is that this depends not only on community level trust and collaboration, but on relationships that are in the household and intra-household. And that's really at the center and the heart of the issues around gender and women and their roles in the household, and how that links to community development. So this is another framework that we can use to think about gender-sensitive planning. So empowerment framework, this is talked about by Naila Kabir first in 1999 in her article, The Conditions and Consequences of Choice, Reflections on the Measurement of Women's Empowerment. And she brings up the critical point of how life choices end up impacting quality of life, end up impacting your access to services. So I was looking at Nigeria, thinking about decision-making agency among households there, and there was one study that looked at this, Kritz et al. In 1997. So what you decide to buy in the house, whether the wife works, how to spend her husband's income, or whether she has her own, the ability to choose how many children you have, or use family planning, or send your children to school, all those kind of strategic life choices end up impacting your quality of life. And so Naila Kabir talks about these as preconditions, your resources, your agency, how you use your resources, or how you're able to use your resources, and to what extent do you have a choice? What extent do women have a choice around how to use their resources? And then outcomes. And then lastly, this is something I'm wrestling with, which is specific to the water sector, but looking at how does household access to water reflect these relationships that are embedded within households and in intra-household relationships, as well as at the community and as part of larger contexts. And this is what my dissertation was about, and work that I'm continuing to work on has to deal with, is how do we understand how households access to water within these set of embedded and nested relationships. And so this is a diagram. I'm looking at the overlap between the individual, and in most cases that's I'm looking at women, given their responsibility for securing water for the household, and looking at the individuals in the context of the household, in the context of the neighborhood, and then how that is embedded within a specific policy environment that impacts how services are provided to the household. So what I'm arguing is that we need this kind of more contextual understanding of how basic services work, and how basic services differentially impacts women if we're going to make any real headway towards those statistics, for example, in the Millennium Development Goals, and improve access to water and sanitation and energy on the ground. Because even if we, at the macro level, increase the amount of water that flows through cities, or the amount of electricity, whether a particular household gets access to those services or not is going to be moderated and mediated by these relationships that happen within and between households. And so to the extent that planning can provide ways and tools for women to exert their agency, things will be better off for households. So that's the gist of where I am with the data I've collected so far, and with this topic of gender-sensitive planning and gender-aware planning. So I'd be interested if you have questions and what your thoughts are about this. My last two slides I have are online resources. So these are places you can Google them to get data. If you're interested in doing work on around international development, these are some of the main places to get data. And then this is the article that I published in 2010 that was published in Gender and Development. If you want more detail around this topic and how women mobilize for urban water in Nigeria, I would refer you to this article. So in terms of thinking forward, the main findings: housing configuration, how many children women have matter, income, age, quality of services, and why they chose the particular neighborhood seem to mediate how free are women to choose where they live. And this has implications for participatory interventions, any kind of participatory-based governance and participatory planning. We have to be thinking about these embedded relationships within and between households and communities, and how women are at the center of those embedded relationships. And I did find support for Naila Kabir's work that showing that strategic life choices, whether to marry, have children, the kind of work you do for women does impact other less consequential, maybe seemingly less consequential choices that impact their quality of life, such as the quality of housing and their subsequent access to water and other basic infrastructure. So thank you very much for all of your attention today. This is my contact details, my email, and our website at the Knowlton School of Architecture. Please feel free to contact me if you have any questions or would like more information, or want to talk about work that you're doing. I welcome it. And these are some of the community women's, one of the moms in Uganda, and those are her two daughters that go to the youth center I work with there. So thank you for your time. I hope you enjoyed today's case studies of community development challenges facing women and potential opportunities for moving towards gender-aware planning. Thank you very, very much.
Okay, great, Charisma. We're going to take some questions now. So our first question comes in from Kelly O'Neill. Everyone pays for water in developed countries, either directly through paying a utility bill or through paying rent where the water payment is factored in. Could you elaborate on how UNICEF or other organizations define that not everyone pays for water?
Sure. What they're referring to is the purchase of bottled water. And so not every household purchases bottled water in order to for their drinking water. And so what the Joint Monitoring Program is saying, households that have to purchase bottled water for drinking water don't have access to improved sources of water. So that they're specifically referring to bottled water.
Okay, great. Our next question comes in from Douglas Martin. Are Uganda and Nigeria indicative of the majority of countries in Africa in terms of gender bias? Is there a relationship between types of governmental structures throughout different countries in Africa and gender bias or degree of gender bias?
That's a big question because we got 52 countries, but I would say yes, they're indicative of the kinds of gender discrepancies. You'll find similar things in most countries, although the specifics of that will vary. You do have, I'm thinking of Ghana, the Ashanti, women are, have a much more dominant and central role, and take more of a decision-making role in households. Whereas in other communities that's not the case. You also have differences by the traditional governance structure. So for example, in one of my two sites in Benin City, the traditional leadership, there's a king called the Oba, and there's a traditional chieftaincy, is very, very strong, and women can't interact with that structure at all. And when it comes to advocating for your neighborhood, then that means typically a man who's the oldest person who lives on the street, is the one who represents your neighborhood in the court of the king. And the state government defers a lot in terms of responsibility for addressing community concerns to traditional structures. And so where you see those kinds of traditional structures around the continent playing a very central, dominant role, then you'll see similar relationships. So there's a lot of variety on the ground. So thousands of ethnicities and groups and traditions and cultures, but there are some common threads in these two cases that make them very, very illustrative of what's going on across the continent. I hope that answers your question.
Okay, our next question comes in from Kim Tran. What is related to the theory of reasoned action in this study?
Yes, thanks. You were looking at my slide on the water demand framework. I didn't talk about it as much in this paper. That has to do with my dissertation, where I was looking at how do households cope with the lack of access to basic services, and I was using Albert Hirschman's exit, voice, and loyalty framework to see when you're facing a water cutoff or a pipe burst, or some other factor that impacts your access. Do you speak out about it? So do you exercise voice? Do you use the market mechanism, find an alternate supply, or do you kind of acquiesce or wait for things to get better? Do you exhibit some kind of loyalty, whether it's loyalty by acquiescence or enforced loyalty because you don't have a choice? And so because I was looking at how people make decisions, that's where I was looking at the theory of reasoned action in terms of how people make choices and the psychological reasoning behind the choices they make.
Okay, our next question comes in from James Garofalo. Did you see any impacts from the Uganda Civil War or Nigerian oil conflict?
Not in, the Civil War in Uganda is in the north, and in fact everyone, while I was there, everyone kept saying how they're always frustrated because you don't really have the impact of that in Kampala, and yet people are advised not to travel to Uganda. All of that's in the north and the border with the Congo. So I did not see that, except to the extent that people who are from those regions will flee the fighting and live in cities and migrate more to cities, but not directly. In Nigeria, Benin City is part of the Niger Delta region, but it's not in the area that's most directly impacted by oil, by the oil industry, although it is part of the Niger Delta region. But I do work with people who do work in the Niger Delta region, and the challenges are even more incredible. Because of the massive pollution by the international oil companies have destroyed drinking water systems and have destroyed the environment and the people, the sources of people's livelihoods and food. And so the impact in Nigeria in terms of where the wealth comes from, but the people who are suffering, paying the price for that, is huge in the Niger Delta. But Benin City is part of the Niger Delta, but not directly in the areas where the oil companies are operating. So not directly part of this study.
Okay, well, actually we haven't received any more questions. I guess we can wait a moment and see if anybody else has any questions they would like to send in. Otherwise, we might end a little bit early. Okay. So this question comes in from James Garfalo. Are there civil service departments creating new infrastructure?
Yes. Can you hear me, Brittany?
Yeah, I can hear you.
Okay. I keep pushing my mute button, so I'm not sure. I need to leave it alone. Yes, there is. In all the countries, there is a civil service. In various countries, sometimes the civil service is centralized and tied to the national government, and in other countries it's decentralized. Uganda is a centralized civil service. The Water Supply Authority is national. In Nigeria, it's the local government, state government, and local government that are responsible, for example, for water. So you do have government structures that are tasked with this. Nigeria went through privatization in the 1990s, and that improved the quality of water supply a lot on the ground. So they went through some major reforms in their water sector. I think the biggest challenge when it comes to the civil service is dual: is funding and prioritizing the civil service by higher levels of government and where the money for it comes from. So, for example, in Nigeria, oil revenues fund the government as opposed to taxes. So in terms of where is the accountability going, it goes up towards the central government instead of down towards the people. And I think that has an impact on the quality of services provided. But also in talking, to be fair, in talking to civil servants, they also talk about their own frustration with the lack of budget. For example, when the electricity goes out in Nigeria, and they need fuel to run the generators, the big generators to pump water through the city. Well, they don't have they don't get the budget, to buy fuel to run those generators. So, yes, there is a civil service there, and there are reform efforts going on, but there are challenges related to both finance and governance.
Okay, and we have another question from Jason in Michigan. How can microloans help? Do they cause a widening gap when focused only to women?
No, actually, I think microloans are a great approach. In fact, I'm going to pronounce this wrong. Ahmedabad in India, they've successfully used microloans to fund infrastructure development, both water and sewerage, and it's women who have mostly been the ones to take on those loans and have been the ones actually building the infrastructure, and it has been successful there. There are microloan programs in Nigeria. I'm not as familiar with the microloan projects in Uganda, but mostly they're for private enterprise activity, not using microloans for infrastructure, for public infrastructure. But at least I know of one example where microloans in urban settings to fund infrastructure has worked, and that is in Ahmedabad, India. So that's a potential approach that could work possibly in other settings.
All right, our next question comes in from Patricia Malley. In your studies, did you examine any gender-related planning concerns, examples, or practices from Cameroon? If so, how did they relate to the ones you mentioned already in your report?
I'm sorry I didn't look specifically at Cameroon. I've looked at other cases, Ivory Coast, South Africa, Senegal, but I haven't specifically looked at Cameroon. If there's anything about the Cameroon case that's interesting or that you want to ask as a question, I'd be happy to think about it, but I haven't looked at it yet specifically in relation to this study.
Okay, our next question comes in from Stephanie McBrayer. Where do you see hope for the future in this situation? What is working best to improve the lives of women and children in these households?
I think I think the hope is there on the ground already every day with the women. It's just aligning our planning practices with the women, giving them opportunity to have a voice and participate. And it's not easy because of the variety of how governance operates on the ground in different places, and as I mentioned before, traditional structures. But we have to keep working on it, and we have mechanisms to do that in terms of planners in other settings, working in partnership with communities on the ground through nonprofit work, through international development assistance. Those are mechanisms that we can use to open pathways for women to take a stronger role and have a stronger say. We have to start with just listening to women, and I think that came out a lot in this study. Just by talking to women, you discover so much of what's going on and what are the real challenges in improving access to basic services. And so just that insight alone will help improve the delivery of basic services, and then finding formal mechanisms through which women can officially participate and be empowered to participate. I'm not saying it's easy, but that's where it lies, in listening to women and then creating opportunities for them to be directly involved in the decision making around these basic services, because they know it best.
All right, great. We have one more question from Kim Tran. What is your suggestion for further study?
Well, there's a ton of research going on around these issues. I think planning is now at a zenith when it comes to international development. I'd recommend the 2009 Global Report on Human Settlements. I mentioned it in the last slide. Also, housing, The Poor Die Young: Housing and Health in Third World Cities. That book. I think are great places to start to look at the intersection between issues of housing, infrastructure planning, and challenges around public health and economic development. But I think the future is in those intersections. It's planners taking seriously the idea that how we plan impacts public health. And we have challenges doing that here in the U.S. I've talked to our students who have internships in local agencies who want to include indicators around public health, on maybe some housing projects that they're working on, and there's no support for that. Massive pushback. Like, no one wants to take on more responsibility than what their official job description or agency portfolio says. But we have to take seriously the interaction between planning, health, economic development, and hold ourselves accountable for those things if we're going to see improvement on the ground. And so I think planners who are versed in what's going on in other fields, make for better planners and better advocates on the ground or in their professional life.
All right, our next question comes in from James Garofalo. Is the foreign aid addressing these problems as much as just studying them?
Well, I'm not sure exactly what you mean by that, but if you're asking is aid effective, it can be. I mean, it's flowing every day, various forms of aid. For example, in Nigeria, just 5 years ago, they received 2 states there, including Lagos, received $190 million zero-interest loan from the International Development Agency, an arm of the World Bank, to improve the water infrastructure. So there is assistance that's going, but it can always be better. So it goes hand in hand. You have to study it. You have to read about what's happening. You have to learn about it, and then if you're inclined and interested, get involved and be a part of it. But I'm not sure if I answered what you were actually asking. But they're both important. You need the aid, and we need new thinking going into the field and being a part of the solution.
Okay, our next question comes in from Ed Lynch. How well is land ownership documented in tribal areas to be able to manage the sources of water for future generations and to allow women or cooperatives to purchase those rights?
Yeah, land is a really big challenge because of for a couple of reasons. Setting aside for a moment documentation and paperwork, you have the traditional forms of land tenure and then civil forms of land tenure, and then you have very different structures. Like, for example, in Nigeria, there's no real private property rights. The state owns all the land. At most, an individual gets a perpetual right to occupy a piece of land, but they never fully own it. And of course, land tenure and ownership impacts how resources are utilized and environmental sustainability. So you have very different land tenure, land rights in each country, and then you have the traditional versus civil forms of land tenure, and then the whole documentation aspect is a whole other factor on top of that. And there's disputes all the time. That's why you go to many cities and you'll see people writing, this house not for sale on the side of the house because of the documentation problem. And land gets sold out from under people all the time, and there's disputes all the time around that. And these are some of the kind of practical challenges around not having records administration and digitization of files, and that's why there's a lot of funding around those kind of projects now in developing countries to kind of digitize records and make databases and make those publicly available, because those kind of practical things do impact tenure and how land and resources are managed. I hope that answered your question.
Yeah, okay, well, our next question comes in from Douglas Martin. Are water, sanitary facilities, roads, and other infrastructure linked between countries in Africa or wholly contained separately within each country?
That's a good question. It depends on the service we're talking about. So in terms of major roads, there are some major roads that cross international boundaries. Water is another resource that can flow between countries. It's more common for electricity to flow. So I know one of the complaints that people have in Nigeria is that there's not enough power for the country, and yet the government sells energy to its neighbors and makes money off of selling electricity to neighboring governments, and yet can't supply enough energy to the people in the country. Same thing is in East Africa with Uganda. They're part of a regional power sharing system. So around some infrastructure there is cooperation, roads and electricity being main ones, but others like water, particularly water for drinking or household use, and sanitation are localized, and they can be localized within cities, and at the ultimate level, like what I saw in Nigeria, localized to a household. Because there's no, most households don't have access to piped water. People are just digging boreholes, deep wells, using motorized pumps to suck water out of the ground. And so you have a city in Lagos of 10 million people, and only 5 million have access to the piped water. So the other 5 million are using groundwater, and that's not sustainable at all.
All right, well, I think that will be our last question for the day. Thank you so much, Charisma. And if anybody has any other questions they would like to follow up, your email is acey.1, correct?
Yes, acey.1@osu.edu.
All right, well, thank you so much for the presentation today. And for those of you who are still in attendance, I'm going to go through a few reminders on logging your CM credits in just a moment. Thank you, Charisma.
Thank you very much, Brittany, and thank you, everyone. I enjoyed it today.
All right, well, for those of you who are still with us today, I'm going to go through a few reminders. First off, to log your CM credits for attending today's webcast, please go to www.planning.org/CM. Select today's date, which is Friday, March 2nd, and then select today's webcast, which is Community Development in a Global Context, Gender-Aware Planning in African Cities. This webcast is available for 1.5 CM credits. We are also recording today's session, so you will be able to find a recording of this webcast along with a 6-slide per page PDF or just a PDF of the PowerPoint at www.utah-apa.org/webcast-archive. And this does conclude today's session, and I want to thank everyone again for attending.